just speaking to Dr. Louise Newson, but I nearly said my menopause doctor because I see that's what you are on Twitter, Louise. Just if people want to follow you, at my menopause doctor. All right, we've got lots and lots on this, and Tiffany in Devon, I know you would appreciate Louise's advice.
Yeah, that would be great. Good afternoon to you. I've been experiencing all of the symptoms that have been mentioned for probably at least a year now. I've had loads of blood tests and it all comes back as absolutely fine. But I'm absolutely convinced, I am tracking my periods, there's differences there. My words, even now I'm usually a really articulate person, but I struggle to get my words out. My words kind of come out the wrong way. I feel that fuzziness. And for a long time I felt quite anxious about that and was starting to kind of cut all the other stuff out of my life because people were saying I was stressed and my hair was falling out. And I kind of just think, in my heart, I really feel that this is what's happening to me, and I wonder how I can progress to the next level.
So I'm sure you're right, and we work out of the NICE guidance, the National Institute for Health and Care Excellence, menopause guidance that came out nearly 6 years ago now. But they say blood tests, actually, if women are over 45, they're a waste of time. If they're between 40 and 45, they may help. If they're under 40, then they should be done. But actually, in my clinical practice, I do not use blood tests to make a diagnosis of the perimenopause or menopause, especially during the perimenopause. Hormones can really fluctuate. So I might do a blood test one day and it will be normal. 10 minutes later, it might be abnormal. At 3 in the morning, when often people are waking up with night sweats, it's going to be low, but I don't want to come and do a blood test at 3 in the morning. So actually we go by symptoms, and this is why the free Balance app, which can be downloaded by anyone, you can put the symptoms and, like I say, create this health report, which is a really good way of going to the GP. Now, we know that actually over £9 million a year is wasted on inappropriate hormone blood tests. Menopause services are really shocking in the NHS, and I'm delighted that I'm working with the NHS on their new menopause programme to improve that.
Just on Tiffany's issue,
Yeah, so what you need to do is get the health report, go to your doctor and say, I've read the NICE guidance and actually the blood tests are irrelevant. I would like to try HRT. Because normally once you start HRT, you know within 3 months whether you're improving or not.
Tiffany, you obviously are pretty clear in your own mind that you're in the perimenopause. Did you not think of HRT, or did you get turned down for it?
To be honest, I thought that was only something that would be offered to you once you had officially reached the menopause. So I guess that, this is really interesting listening to this now. And again, based on all of that kind of, the blood test work. So, it's not really something that has either been put in my way or I've even thought was relevant for me right now.
And I see when you called, you said you'd been losing lots of hair as well.
Yeah, so literally from the itchy skin to the waking up at night to the muscle joints to the kind of feelings of anxiety, even though I know that I'm not feeling anxious, it's a very different anxiety. Just the not being quite sure of myself. And then, the hair in the last year has been the absolute last resort. It's devastating because it's not just a thinning. It's like, so much of it has gone. I was very lucky. I had a huge mane of hair before, so doctors kind of look at me as if to go, well, you've still got some. That's, be grateful. But it's kind of being confident and knowing what is different for your own self. Totally, and I know that for my own self.
Is that common? Okay. Sorry, Tiffany. Is that common, Louise, losing hair?
Yeah, so hair and skin changes can be very common because estrogen, again, is very important for hair growth. So a lot of women notice hair thinning, they notice dry, sometimes very itchy skin as well, which can all be related.
Tiffany, all the best. Absolutely. Thank you so much for calling.
Thank you. Thank you. Bye-bye.
Bye-bye. Leslie Tate in Leeds says, I noticed...